Welcome back, loves. I am so excited to talk to you about a special topic, anger management. If you have been listening so far, then you know that this season we're talking about all of the things that could come up in therapy and how I would address them as a clinician. Now, some therapists might have a different approach, and that's okay because we're all unique. And I think because you're an individual, you deserve a therapist who's going to look at your situation, properly evaluate it, and apply an individual approach to it. So today, the topic has been coming up a lot. So I thought this would be great for episode 5 of this season. And I'm going to make this one shorter. One, because I want to test some things with the places that I'm hosting the podcast on. And then also because life is just busy. If you are also a caregiver of some sort and your children or the children you care for are home for the summer, then you know how busy it gets. And I'm the kind of parent that really wants to prioritize my kids and make sure that they're getting all of me, especially during the summer. So, it's just been busy and I'm not going to drag this one out. And if you've listened to the previous episodes, then you kind of know some of the first things that I'm going to say in terms of the steps that I take people through when they're addressing anger management in therapy. Now, I will say that some people will come to therapy and say that dealing with their anger is not enough of an issue to warrant therapy. And that is not true because if you have anger, it's likely impacting so many areas of your life, including parenting, right? And so sometimes it comes up as an issue for current clients, and that's an easier route to take with someone who's been in therapy. They've already had my validation around the small, medium, and large issues of life. So they know, look, anything I bring to Marquita in a therapy session, she is going to hold space for me and not make me feel like this is too small for therapy. When there is a new client, we have to start from the beginning. I've mentioned before that I always start with a free 20-minute consultation. That is important to me. And it should be important to you if you're thinking about starting therapy because it's an opportunity for you to get to know the therapist and just kind of see their body language, get their answers to certain questions you have about starting therapy with them, and ultimately decide if it's a good fit. Does it feel like a good fit? Because we can have all of these credentials on paper and it not really translate in terms of how we work with people. And we can also sound really good online. Like let's say you found a therapist blog online and that person was in your area and or just licensed in your state and you thought, wow, I really like the flow of their language online, the way they write these blogs and the information they share. And then you do a free consultation and the vibe is just not there. So it's a perfect example, right? You could even follow some therapists online and think, oh, that person seems really cool. And then you get in a consultation and they bring none of the energy that they're showing up with online. So the free consultation is where you should start. I will say that some therapists are now charging for their consultations and everyone has the right to charge for their time. I don't charge for it mainly because I want to know for me too whether or not it's a good fit. So um, I pour a lot of passion and heart into the work that I do. My business name is Whole Heart Counseling. I do this with my whole heart. So if I'm going to spend an hour with someone weekly or monthly, however often they're meeting with me, I want to know that they're bringing something that I've actually addressed before and feel like I can navigate well with them in session. And there's a good connection and we will be able to build a healthy therapeutic alliance. So there's that. The consultation is important. During the consultation, I'm gathering a basic understanding of how the anger is presenting. And then if the person says, yeah, this is a good fit and I think it's a good fit, we move forward. I send the rest of the paperwork and then we get that intake scheduled. I usually get the intake scheduled at the end of a consultation. Why do I do that? It's a commitment piece, right? Once people say, I'm in, I want to work with you, I don't want to let you off without scheduling that consultation unless you really say you want to do it on your own, which is fine, right? But some people will straight up say, you know what, if we don't schedule it now, who knows how long it's going to take me to log back into the portal and get that scheduled. So it's a convenience thing, really. It makes it easier for people. So we get that scheduled. Before the intake session, the person has filled out all of the paperwork, which includes the psychosocial, where I gather a deeper understanding of the problem, how it's presented. And I say deeper, I'm really asking what are the goals? What's the problem that's presenting? Oftentimes, when people can sit down and write it out, their flow of thoughts is just a lot easier for them to put that on paper. So I tend to get a little more information in the psychosocial than I did in the consultation, which is cool because then I'm prepared for that initial full intake session with the information I've gathered from both of those. So there's that. So in that intake session, after we go through the limits of confidentiality, all of that information, I'm then going to explore the current presentation of the anger. And because I love to practice psychodynamic therapy, I'm always curious about the childhood, right? You weren't born yesterday, so how long has this anger been there? How is it presenting? I don't always go into someone's childhood because sometimes people don't want that approach. You get some people in therapy and they really want a solution focused approach, which means they want to start from today and move forward. They don't want to go backwards. They don't want to explore themes in their childhood. That's what psychodynamic is all about, psychodynamic therapy. And so we don't do it, you're the driver, I'm assisting, and you're the driver. So if the person wants to go into the childhood though, we do. Because I'm interested and curious to know, how did the people you grew up with handle anger? And you know what? I'll tell you something that I hear a lot. A lot of times I'll hear people say, I had a really good childhood, but my sibling didn't. And we grew up in the same roof. So that doesn't make sense to me. We had the same parents. So it makes no sense as to why they have anger issues and I don't. We just don't relate on that. And I always get to tell people, well, but you're two different individuals having an individual experience with your parents. So yeah, you can't take that away from them, right? They had their own experience. And we all know that sometimes there's favoritism in families with the parents or with other family members. Sometimes there's favoritism in school that plays out in classrooms. So kids could be bringing that home, and all of this stuff could be hidden by the child and or just not dealt with in the home, even if the parents know. So if you carry that into adulthood, well, then we have to go look at that. Or maybe you had a traumatic childhood and deep down inside, you're really angry about it because you just came back from a family reunion and you saw some of the family members that had harmed you in certain ways. And that's what activated that anger that's now presenting at work, but you don't see any connection to your childhood, right? So I love talking about this stuff. So I'm going to stop myself from going any deeper into examples. I think you get the point. The anger that you are experiencing currently could be tied to childhood experiences. That being said, it could also be tied to things that happened 2 years ago in adulthood, right? So we really just have to get in there and explore and see what themes are popping up. Which brings me to the next thing. I really want to understand what themes are present in your anger. Is it only popping up with certain people? Is it only popping up at certain times, in certain places, when you're in certain moods, when you have or have not been regular with your workout routine? Is it popping up more when you haven't had your morning coffee and then you go to work? Like what are the themes around it? Because that's important for our tracking efforts and again, developing a deeper understanding of how anger is manifesting in your life. And then, of course, this whole time up until now, I'm thinking, what diagnoses are present? Some people come to therapy and they'll say, I've previously been diagnosed with major depressive disorder or PTSD, which is post-traumatic stress disorder, or I've been diagnosed with generalized anxiety disorder, or I have, family issues and relationship conflicts, so on and so forth. It's helpful to know that if you are someone who's listening and you're thinking, I really need to get back into therapy, you don't need to hide that from us. It's helpful for us to know what you have previously been diagnosed with. Now, if you don't come with a diagnosis because maybe it's your first time in therapy or your previous therapist never told you what you were diagnosed with and you never requested your records, which you're entitled to, by the way, under HIPAA, just got to throw that in there, then make sure your therapist can diagnose you and has those privileges in whatever state you're in, because there are different licenses that give different privileges when it comes to psychotherapy. So if you're someone who is seeking a formal diagnosis, that is important. We can see as clinicians threads of anger rather in a lot of diagnoses, right? When you see people who have bipolar disorder, there's anger there. Anxiety. I mean, I have an anxiety experience from time to time. And then, it makes me angry. Why is this popping up now when I do so much work daily to manage it? You can have anger certainly when you're depressed or when you're dealing with childhood trauma. You can be very angry about the fact that it's still bothering you to this day, right? It's unresolved, unaddressed, untreated. So yeah, I would be angry about that too. So I want to understand if there's a diagnosis present because that does change the treatment trajectory and it does change how we address the anger. We're still going to be addressing some anger management skills. And now I need to know, do I need to refer you for a consultation with a medication prescriber to get the anxiety or the depression or the bipolar disorder under control so that that can take the edge off of the anger too while we're working on some skills you can practice daily that don't require medication, right? And so that's where we'll go if it's seeming as if there's a diagnosis that could be attached to the anger. And then, I want to definitely explore skills that a person currently has. And so I don't just jump into, well, here are some skills that you can do to manage your anger. I've gotten a good overview at this point. I also want to know what you're currently doing to manage the anger. Are you exercising? Are you practicing any kind of deep breathing strategies, visualization? Are you doing grounding exercises? Do you already practice CBT skills, cognitive behavioral therapy? Are you meeting with any coaches, fitness coaches, career coaches? Are you meeting with any mental health coaches outside of meeting with a psychotherapist? What have you been doing? Have you been avoiding certain places, certain people to make sure that your anger doesn't get activated during certain times of the day? Oftentimes people are already doing something and they just haven't identified it as a coping skill. So I definitely want to give you credit for the things you're already doing. And then I'll just ask that question that relates to openness. How open are you to us exploring some skills together to add to your tool belt that will help you better manage the anger? And people always say, absolutely. Whatever you got for me, give it. I will practice it right away because I just want to get better and you deserve to get better. So then I will go through some of the things I asked about, right? If they're not doing all of those things, which typically people aren't, they'll just say, oh, I'm trying to avoid that person or that place. I'm just trying not to think about my anger, right? Then we go through all of those skills. And one of the coping skills may be you need to come to therapy regularly so we can discuss the anger, how it's manifesting, so we can keep up with the anger. Maybe you're journaling in between sessions so I can get an understanding of the range that you really see in your anger experience. That's a whole intervention for you coming to therapy. That is the big intervention, right? So it's just important for you to know that anger is a part of your experience as a human. And in this episode, we're specifically talking about anger with adults. A lot of the things I've shared, yes, you can do those with kids. And we tend to treat it differently when you're working with kids because, of course, then you're incorporating play therapy, which you don't typically do with adults, at least not in my practice. Some people do art therapy and different types of therapeutic interventions with adults that they also apply to their work with children. I just don't. I'm a virtual therapist mainly, so it doesn't get that creative, right? So I want to normalize anger though, because when people think about emotions, they put them in a very small box and they tend to forget that it's okay that they get angry. That's normal. It's okay that you have anxiety from time to time. That is normal. What's not normal is you going from 0 to 10 in 2 minutes and blowing up on someone or being so angry that you feel disconnected from your body. Like that's not normal. And so that has to be managed in a very healthy way for you. And that's my job as a psychotherapist. And that's your therapist's job when they're working with you. So then from there, we're teaching the anger management skills. Some people are up to role playing. I don't really do much role playing. It's more so how would you handle this situation based on what we discussed, or what would you do differently now that you have some skills under your belt that you hadn't used before. In those follow-up sessions, we're basically refining those anger management strategies. We're making them even better because again, you're going to get angry again, right? You don't just get rid of it completely. You're still allowed to get angry. Maybe you came into therapy and you said, look, I've been reaching an 8 to 10 way too often. I'm not necessarily trying to get you to a 0 if you're getting to an 8 to 10 because you're in an unhealthy, toxic relationship. Well, you might want to save a little anger so you can recognize that that situation is not healthy for you. So what's more reasonable? Maybe you say, you know what, I'm getting angrier every day about my situation with this person that I'm spending my life with who's not treating me well. But that anger is getting to an 8 to 10. And now I'm taking it out on my kids. I think I can manage my anger better if it gets down to a 3 to 4. That's a good goal to shoot for. Let's lower it, because 9 times out of 10, we're going to get it down even more. And throughout the process of therapy, if there's another diagnosis present, right, we're managing that anxiety, we're managing that depression well, and then we're working through, and I'm helping you heal that childhood trauma. So now you've recognized that this is a relationship you need to leave. I'm just giving that as an example that might land well with someone who's listening to this. By the way, if you're in a toxic relationship, you have every right to be angry about that. And you also have every right to seek therapy to help support you while you navigate that relationship. Notice I didn't say leave, because that's not where we jump to in therapy. We don't jump to telling people what to do. We help them explore their options. We help them navigate the situation as safely as possible. And for a lot of people, that does not mean leaving right away. Okay. So you're implementing those daily self-regulation strategies. You're utilizing the skills. You're maybe increasing your physical exercise to handle your anger, deep breathing exercises, CBT skills. You're going to therapy regularly. How do you know when it's time to stop therapy for anger management? I have a lot of people on my caseload who come in for maintenance work. So maybe you're a person who just drops down your frequency, and maybe you're someone who says, you know what, I got a handle on it. I feel really good now. I know we said my initial goal was to get that anger down to a 3 to 4 range. Well, it's actually at a 1 to 2. And I've been like that for the past month and a half or 2 months. So, hey, if you want to terminate therapy, it's always your choice. You have client autonomy. I just wanted to share with you how we handle anger management. And you will always know, at least in my practice, that you have a space to come back to, a safe space if it ever pops up again. So hopefully, if you're dealing with anger management, this episode was helpful for you. If it was, I would love to see your comments in the comment section wherever you're listening to this at. I know this episode is audio only. We will get back to video at some point. So let me know your feedback. Let me know if you've ever dealt with anger and received help from a therapist. Let me know if, because of listening to this episode, you're going to consider it, because the whole mission of the Anxiety and Free podcast is to empower you to consider therapy. So have you done that? Has this episode helped you consider therapy? I sure hope so. I'll see you next time. The Anxiety and Free podcast is sponsored by Find My Therapist, connecting you with therapists at findmytherapist.us. If you found today's episode helpful, please share it with someone who might need it. Tune in next week for more conversations on navigating mental health and finding your freedom.